allow me to bring in two more based on our conversations yesterday night. We discussed a lot about the equipment, services, and local manufacturing, availability of medicines, and I'm told we have a local manufacturer of, I think, medicines that would want to speak. And then we had a conversation about registering Kenyans to SHA. I think the number is, once a country is at 85%, then you are well on the way to UHC. And Mombasa County, Governor Abdul Swamad, as that yesterday, was at 84%. And the co-chair of the UHC 2030 would want to comment on that. So allow me to pick on those two, on the local manufacturing. Behind me. Okay. Who? Him. All right. Your name just in under 1 minute, please.
Thank you very much. Your Excellency, the President, all the dignitaries, my name is Dr. David Maina. I'm a pharmacist in the field of local manufacturing, and I'm here on behalf of my fellow colleagues who are manufacturers. We want, first of all, on behalf of the local manufacturers, to greatly thank you for this audience and for your commitment towards universal health coverage. We are very grateful. We've actually been looking for such an audience for a long time, and this is the right time. Your Excellency, we have about 40 manufacturers, local manufacturers in Kenya. The 40 manufacturers produce medicines and take care of about 30% of the local consumption. Your Excellency, that's very key, because what that means is that the other 70% is not made locally. That means it is imported. Let me also emphasize that the percentage is not in terms of the number of packets of medicine, it's a value. So if the local manufacturers are doing 30%, the 70% imported is high value. And if we did it locally, it could cost us maybe 30% or 40%. Having said that, we also, as a manufacturers, we employ about 1,500 people, about 15,000 people directly, and many more in the value chain. So local manufacturing is a very, very important docket. When I heard many people talking, Your Excellency, they were all referring to medicines, dawa. In fact, some said, unatibiwa, unaambiwa hakuna dawa. At the end of every service delivery, health service delivery, is a product. That is the dawa. And that's where we are placed to ensure that we provide those medicines to the patients so that the whole ecosystem of treatment can be complete. When COVID struck 6 years ago, there was a general crisis in supply chain of pharmaceutical products. In fact, Kenya could not even import a simple sanitizer. Even masks were being imported, that used to be imported, we had a shortage. So I'm saying that because our space, and why this is very important, has two aspects or very objectives. One is to play our role in universal health coverage in terms of supply medicines, quality, affordable medicines. The other very important one is actually disaster preparedness. If another COVID came, that would be a disaster. Would Kenya be prepared? How prepared are we if we are importing 70% of our medicines? Is a big security threat to this country and all the countries in the region. With that, let me acknowledge your support, Your Excellency. 2024, about 2 years ago, we were here at KSAC, and you gave a commitment that Kenya need to cut from 30% to at least 50% supply of local produced products by, I think, 2026, end of this year. With that, I'm happy that we have gotten very good support. Let me give credit. We have a very good Ministry of Health that is very supportive, extremely supportive. There's even a Department of HPT, Health Products and Technologies, at MOH that is supportive. In fact, recently they mined all the data and have a local manufacturing, pharmaceutical manufacturing strategy that was recently. That is very welcome. We also acknowledge, Your Excellency, that you are actually the champion of pharmaceutical manufacturing in the region, the IGAD region. And we are proud that our president is actually the champion. We have good support. However, we have some challenges that we are facing that are preventing that achievement.
Sorry to cut you. If you could just make that brief and maybe do it in a minute.
Yes. I'm going to be very brief. We have some 4 challenges I'll highlight that are making that achievement scaling to 50% become a bit difficult. Why this is important? Because despite the support from MOH, we feel that the challenges cross across the ministries. And it's only probably from your level that can be sorted out. I'll be very brief with that. Number 1 is the cost and the competitiveness of our local products. We have a situation whereby our inputs are very expensive. Because of compliance with quality, and especially now Kenya is undergoing maturity level 3, ML3, our factories are very expensive to run. High electricity bill, all the inputs very expensive. In addition, we have taxation that is not pro-local manufacturing. Especially, we have excess duty on packaging material. Recently, there is VAT added on some raw material. I know that's being sorted out. Why that is, let me add that despite that, we have import duty that is exempted. That's very good. We don't pay import duty. We don't pay IDF fees. We don't pay levy. That's very welcome. But the few things that we pay, like excess duty on packaging material, it's making our products very expensive. We have been engaging MOH for the last 3 years. And we feel that there is a disconnect between MOH and Treasury. Because Treasury on one side says that they need to protect local printers, local paper manufacturers. So they put excess duty on imported packaging material at the expense of pharmaceutical manufacturers. But we can sort out by actually ring-fencing the local manufacturers only. That is an example that imported glass bottles have excise duty into bracket apart from local pharmaceutical manufacturers. That can be done for packaging material. But that has all been done for the last 3 years, and we kindly request if that can just simply be done, we'll be more competitive. The costing part of it also, we are competing with imports, the 70%, majorly from Asian countries. Those imports from their source have been exempted all the duties, and in addition, they get export subsidies when they are bringing to Kenya. You find such that you're competing with a product that is all exempted, well covered by the government, and you're competing with it here. That is us the competitiveness that we are asking for. Number 2 challenge, because I want to be brief, is about regulatory challenges. Among the 40 manufacturers that I mentioned earlier, inspection by Farmers Advocacy Board last year. And it's a good inspection because it is towards maturity level 3, which we fully support. We are in full support of level 3. We think it's a good thing. But despite that, that inspections made 12 companies be suspended their licenses. That means from the 40, you hive over about 1/3. What that means in short is that if you are doing 30% supply to Kenya, you are removing 1/3 of it. You are left with 20%. So we are likely to be in a worse position now, although it's temporarily because of the inspection, than we are then. The other part of the regulatory challenges is that those countries we are competing with, where they are registering a product, they take 3 months to 6 months. In Kenya, we take about 12 months at best to 36 months. That means if we want to have more products, 50% achievement, we have to register more products. There needs to be a fast-tracking method to have those products in the market. Your Excellency, you mentioned, and rightly so, that you negotiated reduction of price by one foreign company from a certain figure to a third. The question is, they were making profit when they were at 100%, they are still making it at 30%. That's the kind of level we are losing by importing. If those resources in foreign exchange can be put in local manufacturing towards the taxation and other cost remedies and support for registration, we will actually achieve that faster. Number 3, and I'll be very brief, is about capital. Okay? We have a situation whereby it is very capital intensive to run pharmaceutical companies. Just the way we have other funds for agriculture and other departments. If we could have a pharmaceutical industrial fund, and we don't want goodies, we don't want anything for free, just easily borrowing and payment, it will help a lot. Because banks perceive pharmaceutical manufacturing to be a specialized field and therefore very risky. They are not willing to maybe buy a machine that is not universally used by other people. Finally, we have KEMSA, which is the biggest purchaser of our goods. KEMSA and county governments. KEMSA and county governments have a policy of the lowest price. That means the initial charge I mentioned about the competitiveness applies when you're tendering for KEMSA. You find that the imports, we can't compete with them. Therefore, despite maybe a 15% allowance, is not enough to attract many local manufacturers to sell more. And even after selling, and this is where the KEMSA needs to hear, takes about 6 months to 1 year to pay. If that can be sorted out, we'll scale up to more produce manufactured. We are ready to support you, Mr. President. If we can have that support, we can actually make quality, affordable medicines, not just for our country, but even to export to our region. Thank you very much.
Very well put, Mr. Maina. Yeah, very well put. I have a couple of questions for some. I think we need to answer this question. I mean, we have transitioned. We were saying initially financing is critical. And then we said human resource is critical. Now we have gone to, without medicine, there is no healthcare, according to Maina. So everything in the chain looks like it is critical. Agreed that we're producing only 30%. That was in 2024, we had a conversation. And my instructions to KEMSA then was we give priority to locally manufactured products. I want to understand first whether, and I had even specific examples. I had, for example, one facility in Kilifi, Revital, and I think they are here. And Revital was manufacturing a lot of stuff in Kenya and could not sell to Kenya, but they were selling to other countries. And it was because of a conundrum at the KEMSA. And I said that should be undone. I don't know whether the CEO of KEMSA is here. Yes. Can you explain to us, I know there was another CEO, what is how has things changed in terms of your purchases? We insisted that local manufacturers should be given priority. Specifically, are you now buying from Revital and they are here? If you say something that is not correct, they will say something different. Just tell us.
Thank you, Your Excellency. Yes, so local empowerment is very important, including manufacture of pharmaceutical products. We are keeping a tab on that. Revital can attest that nowadays they don't complain, they don't write letters. We do a lot of procurement from them. But in general, under your direction, we got instructions in order that we should do more than 40%. I can attest here that our procurement from local manufacturers is 52%. And in fact, from international manufacturers through our local suppliers, when you add those two, over 70% we buy locally. So the preference in procurement works when there is an international competition. We give, according to the Public Procurement and Asset Disposal Act, we give 15% preference to the local manufacturing. And by local manufacturing, 100% fully owned by Kenyans, or more than 50% owned by Kenyans, they enjoy a 15% discount. The only trouble comes in, I think Dr. there has talked a lot about other issues outside us, which affect their costing. So as a government, maybe that can be looked at, but yes, we do, and
Thank you very much, Wako. Revital. Yes, please pick the mic.
Mr. President, thank you. I represent Revital here. I would like to attest to what Dr. said. Yes, we have been getting local tenders and we are able to get that preference. However, mobilization of funds after the supplies is something what we are still chasing on. So
okay.
one tick box checked, but the second one is still in the progress. And just to add to what my colleague said, just like our neighbors, they come up with policies like BUBU, like Buy Uganda, Build Uganda, wherein they are giving preferences to the local manufacturers by increasing some taxes for the imported medicines and products. We are also looking for support from you on that.
We will go there.
Yes.
I will go there shortly.
Sure.
So I just wanted to confirm that we have moved our locally manufactured products in KEMSA from what it was to now you tell me 52% of your purchases are from local manufacturers.
Yes, Your Excellency. I only have one problem with the manufacturers, which I'll take the opportunity. When we strictly label the advertisement to attract only local manufacturers, then they tend to hike the price because they know the international bidders are not in. So I plead with them, when they see it's restricted for local manufacturers, we are a commercial entity. So if they don't give us room for markup, we'll not be able to pay salaries.
Maina, there is some homework for you and your team there. You know, we do not want you to shortchange us. You know, the moment we lock out your competitors who are international, you must not do a cartel business here and hike prices, you know, really. Because we really must be honest with ourselves, because this is public money that we are using. And we want to get value for money. So I think the issue raised by the CEO of KEMSA is an issue that you must address so that we can support local industry and still get value for money for the Kenyan people. We do not want to say, because it's a local manufacturer, then we pay more than, you know, is reasonable for us. That is one issue. But my instructions to KEMSA was that progressively, we must get value for money, but we must support local manufacturers. You have raised a couple of issues. The first issue is we will do affirmative action. I want to confirm to you, we will do affirmative action on buying from local manufacturers. That is number one. And I want to encourage counties, when they too are buying, let us try and see how we can support local manufacturers. You have raised some issues on taxation. We did what Maina said. We removed some taxes, IDF, all the other taxes. You are telling us to go further. and, ring fence. Because, we do not want a situation where we are promoting local manufacture in one space and we are undermining another space. When we put duty on imported paper, it was because we also wanted to support local paper manufacturers. So we must also balance between manufacturers of local paper and the pharmaceutical industry who may want to use paper that is not locally manufactured. And what we should be able to do, and I think Duale, your colleague in industry, Lee Kinyanjui, and Badia Treasury, you should be able to sit down and encourage local paper manufacturers to manufacture the paper that these good people can use in the pharmaceutical space, so that we have we sort out both sides. And now we will be willing to have a conversation, Maina and your team, on how we can bridge the gap between local paper manufacturers and yourselves, and whether it is absolutely necessary to ring fence paper for packaging for pharmaceutical companies in the manner in which you have suggested. Number 3 is we are trying to transition the country to ML3. And, we have to meet certain conditions. If some of our local manufacturers don't meet those conditions, we will undermine the position of the country if we don't meet certain international conditions. So unfortunately, we will have to, to ask some of your local manufacturing entities to up their game, honestly. And the Duale and the PPB people, and Duale, do you want to say something?
Excellency, I know Maina very well. And I had a session with the Kenya Pharmaceutical Association more than 5 times. Today, under your leadership, we have done the reforms that has never happened in our country under BPP. And I want to share this with you. Number one you have answered. Maina is telling us to protect local manufacturing. But the same Maina wants to go and import packaging from outside, and then we remove duty. All that we're telling Maina is there are competent companies in our country who do the printing of packaging and who gets that favor from the National Treasury. 2, Your Excellency, as we transit to ML3, which you have directed, I mean, Kenya is big, it has a big pharmaceutical base for the country and for the region. Kenya is about to attain ML3 by October this year. For us to do that, we have stopped all parallel importation. Because parallel importation was where a lot of fake and counterfeit medicine used to enter our country. In fact, 2,500 products have been removed from the system of Pharmacy and Poison Board to make sure that we, number one, for the safety of our citizens and the dignity of our patients, we must stop counterfeit and fake drugs. So 2,500, there are many people who are complaining. Number 3, Your Excellency, and I think Maina must be be aware, is that for you to establish a pharmaceutical manufacturing firm in our country, all the equipment and machineries are of free duty. They have a huge, no any other country in our region gets that kind of tax incentives. All they need to do is to get a letter from the Ministry of Health to the Minister for Finance, and the Minister for Finance will write to KRA, and they get all the incentives. And that is what we did in the last 4 years. Today, there are more than 12 new manufacturing pharmaceutical companies now. 2, when you created the incentives that the local manufacturing preference be done by KEMSA, a lot of now Kenyan investors, working maybe with other foreign investors, are now establishing their farms in Kenya. So the reforms that we are undertaking, I know the one that he wants me to talk to the Minister for Trade, Minister for Finance. We are in engagement. But again, we must balance. The kind of incentives our pharmaceutical industry is gaining, Your Excellency, is so phenomenal that the element of the packaging, which is very important, all that the National Treasury is saying is that we have given that incentives, that tax incentive to locals, not that you bring it from outside. And I can confirm that Revital, under your direction, and all other companies, what the CEO is saying is true. What they used to do before is they used to mix things, and you're aware of that. Now they're doing specific procurement for specific items. So Revital, unlike before, now they sell to. On the issue of the payment, I think that is now a commercial interest, 90 days, 45 days, 60 days. Social authority under their contract is 90 days. So I think that's something we can discuss. But Your Excellency, the reforms that you asked under PPP is on course and is for the benefit of the country.
Thank you very much. I think this is a fair conversation. Maina, you agree. It's a fair conversation. I think you have asks. They must be, balanced with other. But I think if there is one space that I am very confident about, especially after the meeting I had with the manufacturing community in Kenya, pharmaceutical manufacturing fraternity in Kenya, we have provided sufficient incentives to make sure that those who want to set up manufacturing capacity in manufacturing facilities in our country do so. We have even extended, just for your knowledge, Maina, the special economic zone in Thika. We have said that special economic zone should be made available for manufacturers who want to benefit from incentives in a special economic zone space, long-term investments and all the other things. And we have already provided the first phase of infrastructure in Thika for that space. However, I think we still need to have a conversation about us being able to meet our financial obligation to these good people so that we don't undermine their business. And I thought we provided a facility to KEMSA of 10 billion shillings so that you can be able to pay your suppliers, when it is due, as you wait for the counties and all the other people to pay you. How about, what are you doing? Isn't that some place where you can see how to manage the financial outlay of these manufacturers, especially the local ones who require support?
Thank you, Your Excellency. Yes, absolutely right. I think financial sustainability for KEMSA is something we've been working on under your leadership and the Cabinet Secretary. I really want to thank you for taking it head on. So we have a lot of issues. I know governors are here, the chairman is here. The payment cycle, picking orders and paying for it takes a long time, thereby also affecting our own suppliers. So that facility, yes, I can confirm, it is on. We're just waiting to sign an agreement between the counties, ourselves and SHA, so that we have automatic and automated system to go the full 10 billion capacity. As at now, Your Excellency, I can confirm the national referral hospitals, just to give example of what financial sustainability can do, have already signed under the leadership of the Cabinet Secretary. We have signed with the 7 national referral hospitals an inter-parties agreement. Now that has allowed us to get the facility up to 1.5 billion, and that we have already started engaging the suppliers on that. Then when we sign with the COG chairman is here, and we're working very, very closely with the chair of Health Committee. I even flew to Mombasa to discuss that with him. And I think the future looks very luminous under your leadership. Thank you very much, sir.
Thank you very much. I would really want to persuade my good friends, the governors. I think it is good for all of us. I mean, the principle, and I think we can have this of this stage. The principle is for us to have a complete cycle, that instead of a check-off system, kind of, with SHA on the drugs bit. And I think that's a conversation we can have that will improve the financial ability of KEMSA to procure drugs, and it will also help our manufacturers to be paid on time. I think if we can do that, it would really be very helpful. Yeah, Chair, would you want to say something?
It will be good to have an age data of all the counties to see where they are, because as disbursement flow from Treasury improves, that should also, help them pay faster. But we're also willing to take up that conversation. We have had that conversation of some arrangement, which is debt discounting in a sense, or whatever arrangement that KCB is willing to take up to help counties pay much faster. Our Chair of Health is here. It's a conversation we're willing to have. But also, if there's just some chronic, late payers, it's a conversation we'll also be willing to have with you. Some of us always only have the last order payable, and whenever we get our money, we prioritize KEMSA. So let's see if there's any problem of age debtors, and then we can have that conversation. As for the KCB, it has to be county by county, but I can get an in-principle approval for, from the perspective of COG. Thank you.
Chair, do you want to say something brief? Very brief. I don't know, we have run out of time. I think my good sister there will run into trouble.
Your Excellency, it's true. I did meet with Dr. Wako, and I did present to the full council the various options. One of the things, Your Excellency, that I think if we finalize, and we can even be able to finalize this on Monday, either at IBEC or something, there is a possibility, Your Excellency, by coincidence, the amount of money that counties have to be paid, and verified amounts, is about 5 billion by the former NHIF, which actually is another example to show that NHIF was not working, because 5 billion was actually due to be paid to counties. There's money that Treasury has already dispersed actually to SHA that was meant to be to pay for NHIF. The agreement that we are proposing is, instead of giving us that money, we do a debt swap. And an example is a county like Mombasa that has money to be paid but does not necessarily have money to pay to KEMSA. We'll do a drawdown mechanism. Same thing with Nairobi. The difference from the amount of money that Nairobi has to be paid versus what it is that they have to pay is almost 700 million. If it is acceptable, Your Excellency, KEMSA gets an immediate financial injection of 5 billion shillings. 5 billion shillings injection of money. And the other one now is so that we do not have this problem back and forth, and we do not sit here after 5 years saying that KEMSA has to be paid and we're in the same dark hole again. We were proposing something that the counties can be able to give some form of a guarantee. I know there was a proposal of deduction at source by SHA, and we came up with another proposal because, upon discussing with the CEO of KEMSA, it is something that excites him even more, because a facility, let me not get into the very, very much nitty-gritties, Your Excellency. Those are for behind the tent discussions that we will have, but we have the goodwill to be able to finalize this.
Thank you very much. Are you trying to use KEMSA to collect your debts in some way?
Not at all, Your Excellency. All we are saying is that we have a solution to be able to, first of all, give a direct injection of 5 billion to KEMSA. And with that in mind, bearing in mind that counties like Mombasa and many others that actually do not have to pay KEMSA, but we have to be paid, we are proposing that don't even pay us. Give that money to KEMSA and we'll do a drawdown mechanism.
Okay. Understood.
Yeah.
Understood, Chair. I think the beauty of this conversation is that every matter that has been raised here, there is already an active conversation going on. There is an active engagement, either with the ministry or with the county government or with another stakeholder, giving us the right impression that we are, to a great extent, on top of the ball. We know where the issues are. Some of them are being sorted out. We need to accelerate some of them, and we need to do what we have to do to smoothen the delivery of health journey in our country. Mercy.
Thank you, Mr.